This Good to Go segment is sponsored by Spectrum Health Medical Group.
Summer is finally here, and that means for many of us more opportunities to enjoy fresh fruits and veggies from our grocery stores and local farmers markets. It's also a great time to start incorporating these beautiful foods into our diets more often to help maintain a healthier weight and combat obesity. According to the CDC, the prevalence of obesity in the U.S. continues to rise, and certain populations are at even higher risk. Not everyone has access to those fresh fruits and veggies. Here to tell us more are Pedro Irizarry Plaza and Mary Negron with Spectrum Health's More Life Más Vida program that focuses on disease prevention within minority communities in Kent County and works with people to help put them on a path to better health. Welcome to both of you.
Thank you,
Heather.
Tell me a little bit about More Life Más Vida and the services that you provide.
Of course, More Life Más Vida helps participants understand their current health and the risk for health issues such as diabetes and cardiovascular disease. We offer biometric screenings to evaluate participants' cholesterol and their blood glucose, their lifestyle, BMI, body fat percentage, mental health, and social determinants of health in order to create personalized goals aimed at disease prevention. This year, we also started offering monthly nurse-led classes, both in person and virtually, that bring awareness to different health topics. This month, we decided to focus on health risks associated with being overweight. Unfortunately, obesity is very prevalent in our minority communities.
Tell me a little bit more about why and how minority communities are more prone to obesity and the health risks that then come along with it.
Of course. So studies have actually revealed that non-Hispanic Black adults had the highest prevalence of obesity at 38.4%, followed by Hispanic adults at 32.6%, and non-Hispanic white adults at 28.6%. The cause of these disparities in obesity likely reflects differences in social and economic disadvantages related to race and ethnicity. Some of these underlying risks that may explain disparities in obesity prevalence in these communities could be lower incomes leading to purchasing cheaper, more affordable foods, less access to safe places for physical activity due to living in areas experiencing more crime and traffic, and poor access to healthcare due to lack of affordable health insurance, transportation barriers, language barriers, and mistrust in the healthcare system.
So many different factors. So how does More Life Más Vida step in and kind of try to bridge the gap there?
Yeah, so More Life Más Vida offers free services in both English and Spanish in the neighborhoods where most of our participants live. So this will break financial, language, and transportation barriers that often get in the way of receiving medical care. We teach our participants how to make the best choices possible with the resources that they have. For example, choosing low-cost, healthy foods and simple recipes that are family-friendly. We also connect our participants with free resources within the community to make these choices possible.
Sometimes it's just about unlearning or learning new habits, right? And skills. So is there some, and maybe that is what can be done to reduce the risk of obesity and its health complications?
Yeah, and we really encourage our participants to try to live a healthier lifestyle. This includes eating a healthy diet, participating in regular physical activity, and you don't need to go to a fancy gym. Simple exercises that can be done at home are just as good. Also getting adequate rest, taking care of your mental health, limiting alcohol intake, and not smoking make a big impact on your health.
So you're going to offer the monthly program, the classes. Can people dip in and out, like they see a topic and say, "Ooh, this applies to my life, I got to go to this one"? Can they just come and go as they please throughout the program?
Yes, they can come and go in with the classes. Every month we are offering different topics.
All right. Well, folks, if you are interested in the More Life Más Vida program, you can sign up for the health education class this month at spectrumhealth.org/MLMV. You can also see the phone numbers there on your screen, both English and Spanish language available. Thank you, Pedro and Mary, for the program. It's really terrific. I'm glad to have you here.
Thank you
for having us, Catherine.